They're starting to get rid of gum. 7 years ago.
Great. More detail, please. We're ready.
Okay, there is noise here. Okay, so. The screech of tires and the sound of crunching metal and breaking glass. A deafening silence sets on the onlookers as the onlookers are shocked and dismayed by the scene that's just unfolded in front of them. Are the drivers hurt? Anyone killed? How long is it going to take to get help on the scene? Somebody quick, call 911! When you have a responder, there are many levels of pre-hospital emergency medical service that are provided in the United States. When an injury or illness occurs, the ambulance may respond with emergency medical technicians, or EMTs as they are known, who are trained at the basic, intermediate technician, intermediate, or paramedic levels. These 4 levels are graduated with an array of skills and medications at their disposal. There are many differences that I would like to point out. First, we'll start with a brief history of emergency medical services in the United States. Prior to the 1960s, it was rudimentary at best. It's actually started in during the Napoleon Wars in Europe, where they had the triage areas and battlefield hospitals. Progressed from there to the later World War II, where they actually did battlefield triage and treatment. But from the triage area to the hospital, the patient didn't get much help. Usually they were either in the old rescue squads, which were run by the fire departments, where a patient would get thrown in the back, or usually these were run by the funeral homes that, again, the patient would just get thrown in the back. It was just a means of quick transportation from the scene of where they got hurt to the hospital. Then in 1966, the National Highway Transportation NHTSA, Safety Administration, came out with the paper, The Accidental Death and Disability, the Neglected Disease of the Modern Society. This is also known as the White Paper. This was the first paper that came out and really criticized hospital emergency rooms and pre-hospital emergency care. Like I said prior, that a patient was just rushed to the hospital and hoped that in the emergency room, before they got to surgery, that something, that was just a way to get them there. The death rates went up, or still didn't come down at all, and prior to, and about this time, when the National Highway Transportation Safety Administration took control of this, primarily because of deaths due to auto accidents. Because back in, you had your 64 Chevy Impala, you had your 1963 Ford Galaxy, you could slam that thing into a bridge abutment at 55 miles an hour, you might break a headlight, maybe damage the frame a little bit, but you could still drive it away. But the person inside, there were no airbags, limited protection, most of the interior was metal. As far as the no restraints, no seat belts, the glass wasn't laminated, so you could go through the glass and get cut up. So they, and the emergency rooms too were not as efficient as they are today. Prior to this time, the emergency rooms were pretty much where it was an undesirable place in the hospital. People would rather be on the floors or in the ICU, and it was more of a place like if you were a trouble nurse, you got thrown into the emergency room. Not true today, where it's more of a profession. So it criticized pre-hospital care, and then it became more mainstream when Emergency, I don't know if you've seen the reruns of Emergency, Johnny and Roy, paramedics in LA, go to the scene and solve your problem, start an IV, and you end up going to Dr. Brackett and you end up getting saved. Starting at the EMT Basic level, each level builds upon the other one. In order to go on to the higher levels, you have to start out as EMT Basic. This is under the Wisconsin Health and Social Services. It was the old Health and Family Services. Administrative Code 110. EMT Basic is 120 hours of training, which includes automatic defibrillation for those people who have had heart attacks, non-visualized advanced airways, so such as oral airways or combi tubes, cervical spinal immobilization, and the only medications they can really give are aspirin, glucagon, and albuterol. Glucagon being for diabetics, and albuterol being for people with asthma as a nebulized medication. Then you move up into the intermediate technician level. This one's kind of in flux. It started out under HFS 110, the same as the basics, and it's getting moved to HFS 111 because of as it's an advanced life support skill. It's 40 hours above EMT Basic. They can start IV lines, do blood glucose monitoring, give D50, which is actually better for diabetics. It's sugar that gets shot right into the vein. Narcan for drug overdoses. Epi 1 and 1000, which is for if you have a bee sting, you need to reverse the effects of the bee stings. Nitroglycerin for heart attacks. Atrovent, which goes along with the albuterol for asthma, and endotracheal innovation. And there's the insertion of an ET tube. Next level up, the level I'm at is EMT Immediate, HFS 111. It's 365 hours above EMT Basic. Things that we can do, ECG interpretation, so that's a 12-lead ECG monitor that we can determine what's wrong with the heart and take different looks at the heart. Epi 1 in 10,000, amiodarone and lidocaine, atropine, morphine, and which those drugs are for if someone has gone pulseless non-breather. Those drugs are cardiac-related drugs that can help start the heart. Narcotics such as morphine and Valium. Morphine to relieve pain, Valium to relieve nervousness, and also muscle relaxation. And interosseous infusions, in case we can't get an IV attempted, we can shove a needle into the bone and give the drugs directly into the bone. The highest level, emergency medical technician paramedic, under HFS 112. It's 1,200 hours above EMT Basic, and that's both classroom, ride-along, and hospital time. It also goes beyond skills, so external cardiac pacing for someone whose heart isn't pacing at the right level, dopamine sodium bicarb for cardiac PUVs again, pulseless non-breathers. Fentanyl is another, just like morphine, it is a drug that relieves pain. Benadryl is also for anaphylactic reactions, so bee stings and that sort of thing. Pericardiocentesis, which you can see right here, basically if the heart, if the sac around the heart fills up with fluid, paramedics can stick a needle in and take the fluid out. And a tracheostomy, which is right here. If there's something wrong with the airway, they can stick a needle right in there and help your breathing. In conclusion, the levels of emergency medical services provided in Wisconsin and throughout the United States are varied from community to community. If you understand the time and resource constraints and commitments that go into providing these levels of service, you may be more aware of what your local emergency services can provide for you.